Hemiplegia syndrome happens when there's damage to the pyramidal system, leading to a noticeable loss of movement in the arms and legs on one side of the body. This condition can appear suddenly or develop gradually, depending on what's causing it. So, if you find yourself dealing with hemiplegia syndrome, what steps should you take? Half-human paralysis. Syndrome is when you lose control over one arm and one leg on the same side of your body because of issues with the brain's pathways. This can also affect one or more cranial nerves, either on the same side or the opposite side. Depending on where the brain injury happened, there are two main kinds of hemiplegia. 1. Congenital hemiplegia. This happens when there's brain damage either during birth or right after. 2. Acquired hemiplegia. This results from injuries or health problems like a stroke. Symptoms and signs of hemiplegia syndrome. Soft paralysis. Decrease or loss of intentional limb. Movement along with the dominant upper limb. Stretch muscle and lower limb. Folding muscle. It may be accompanied by central hemiplegia on the same side with the paralyzed limb, or peripheral facial paralysis on the other side with paralyzed limbs and paralysis of other cranial nerves. Decreased muscle strength or loss of paralyzed limbs. Decreased or lost tendon reflex on paralyzed limbs. Abdominal skin reflex, scrotal skin. Reduced or lost anal reflex. Babinski plus on the Parsi. Hoffman plus on the paralyzed side. Semi-paralyzed sensory disorder can be encountered. The swaying figure with the paralyzed hands. The feet sweeping the dirt. When the patient lies on the paralyzed side of the foot, it falls out. Paralysis. The lateral limb muscle is paralyzed or lost. Central facial paralysis on the same side or peripheral. Facial paralysis on the other side with paralyzed limbs. May be accompanied by cranial nerve paralysis. Increased muscle tone on the paralyzed side leads to spasms of the upper limb. Other fingers grip the thumb and the lower limb spasms and stretch. So when walking, there is a grass-shaped gait. Hyperlyzed lateral tendon reflex. With pathological reflexes such as Babinski, Hoffman, abdominal skin reflexes, scrotum skin. Anal reflexes are reduced or lost on the paralyzed side. 2.3 When the patient is in a coma, paralyzed feet fell out. The patient turns his eyes and head to the side of the paralyzed limb or to the opposite side of the paralyzed limb. When stimulating pain in both hands and feet, the paralyzed side hardly reacts or reacts weaker than the opposite side. The reflexes of the abdominal skin and the scrotum skin are reduced or lost on the paralyzed side. Babinski plus on the Parsi. What should you do if you notice signs of hemiplegia syndrome? First off, if someone is showing symptoms of hemiplegia, it's really important to get to the nearest hospital or clinic. You'll want to see a doctor who can give a clear diagnosis, pinpoint where the injury is, and figure out what caused it. After that, they can set up a treatment plan that fits the situation. Diagnostic diagnosis. It is not too difficult to determine through clinical examination. It is necessary to assess the degree of paralysis to have a suitable care plan. Diagnosis of damage zone. The reasons behind half-body paralysis can stem from either brain, injuries, or issues with the upper spinal cord. Figuring out where the damage is located is crucial for determining the right tests to identify what's causing the problem. Different areas of damage will show unique symptoms, so it's important to carefully check for specific neurological signs that come with the condition. When it comes to weakness from damage in the brain's cortex, patients often show differences in strength between their arms and legs. This might also include facial weakness from damage to the facial nerve, trouble speaking if the dominant side is affected, or spatial awareness issues if the non-dominant side is involved. If the weakness is due to damage in the internal capsule, patients usually have similar strength in both arms and legs, but may experience sensory issues on the opposite side. Facial weakness can occur, but it's not guaranteed. In cases where the brain stem is affected, patients might show signs of peripheral issues, along with central motor paralysis on the same side, as well as problems with the cranial nerves on that side. For those with damage to the upper spinal cord, symptoms can align with Brown-Seward syndrome, which involves central motor paralysis and altered sensations on the affected side, while pain and temperature sensations might be diminished on the opposite side below the injury. Identifying the exact location of the injury is vital for choosing the right diagnostic tools, especially imaging techniques like CT scans and MRIs. Understanding the causes of hemiplegia. Figuring out what's behind hemiplegia starts with asking about the medical history, doing a physical checkup, and running some tests like a CT scan or MRI of the brain. Hemiplegia can hit out of nowhere, and there are a few main reasons for it. First up, we have traumatic brain injuries. These can lead to bumps on the brain, bleeding, or swelling. You might notice hemiplegia along with dilated pupils. A CT scan without contrast will typically reveal a biconvex shape, indicating a mass between the skull and the protective layer around the brain. Next, there's cerebral infarction, where one side of the body suddenly becomes paralyzed. This usually happens without severe confusion or signs of meningitis. A CT scan can show areas with reduced density that match up with the part of the brain not getting enough blood due to a blocked artery. Keep in mind that early scans might look normal and not rule out a recent stroke. Finally, brain hemorrhage can cause sudden hemiplegia, often paired with headaches, vomiting, and altered consciousness, along with meningitis-like symptoms. If a lumbar puncture is done, the cerebrospinal fluid might show blood clots in all three samples. A CT scan would typically show bleeding within the brain tissue, along with swelling and pressure on nearby areas. Hemiplegia syndrome can develop gradually for a few reasons. One cause is brain tumors, which can lead to hemiplegia as the pressure in the skull increases over time. When the weakness on one side of the body develops slowly over several days, it's often due to benign tumors like meningiomas, astrocytomas, or branched gliomas. On the other hand, if hemiplegia worsens quickly over a few weeks, it's typically linked to brain abscesses or malignant tumors. Another factor is subacute encephalitis. In these cases, patients usually show signs of infection and brain damage, such as changes in consciousness, seizures, and dystonia, which can affect both sides of the body. A CT scan might reveal scattered areas of low density, along with swelling in the brain. I hope this article has shed some light on what to do if you're dealing with hemiplegia syndrome. If you have any questions, don't hesitate to reach out to your doctor for more information.